Well, the reason why we conducted this research was to look at complications associated with anesthesia services after a colonoscopy. We were looking specifically at complications within 30 days of the colonoscopy. And studies that had been done prior were really not large enough in order to look at these very rare complications. And so we were able to do a study where we could actually look at rare outcomes in a large enough data set in order to answer this important question. And many studies that have also looked at anesthesia services with claims data, as we did, the use of anesthesia services is served as a proxy for propofol. We weren't able to actually measure propofol in this study, but we understand through the analysis that propofol might be the anesthesia agent that's being delivered with anesthesia services. We were able to use the claims data that come from Truven Health Market Scan research databases of more than 3 million colonoscopies that were conducted in men and women aged 40 to 64 between 2008 and 2011. And with these data, we were able to also ascertain some patient covariates, confounders, such as age, Charlson comorbidity score, the receipt of a polypectomy at the time of the colonoscopy, and the region in which the colonoscopy occurred. The main results that we found from our research was that the use of anesthesia services at the time of the colonoscopy was associated with a 13% increased risk of short-term complications within 30 days after the colonoscopy. And the primary types of complications that were occurring within those 30 days included perforation, hemorrhage, abdominal pain, complications that were secondary to the anesthesia, and also stroke. We did look at our results when we stratified by receipt of polypectomy at the time of the colonoscopy. And in those stratified results, we found that there was really no difference in the results for those who received a polypectomy compared to those who did not, except for perforation. The use of anesthesia services was only associated with perforation among those who had received polypectomy, and there was no association among those who did not have a polypectomy. So to be clear, we aren't specifically saying that receipt of anesthesia services in and of itself or the medication is associated with these complications, but there could be something in the process that's happening during the time of the colonoscopy that could be impacting these clinical outcomes. For example, we had hypothesized that use of anesthesia services might be associated with an increased risk of perforation, and that's what we saw. In the absence of getting patient feedback in terms of pressure that they might feel within their abdomen at the time of the colonoscopy, they might not be able to tell the gastroenterologist that they're feeling this pressure and therefore sort of reduce their risk of getting a perforation if they're under deep sedation compared to standard sedation. All of the results were adjusted for all the patient confounders, but there's still, as a claims-based data analysis, several confounders that we weren't able to adjust for in our analysis. So our main conclusions are that the use of anesthesia services at the time of colonoscopy is associated with some small increased risks of 30-day complications. And this really opens up new questions in terms of the use of anesthesia and possibly propofol at the time of a colonoscopy, which is usually, in many of these patients, a screening exam. So the widespread adoption of anesthesia services with colonoscopy should be considered in the context of all the potential risks with the colonoscopy. A great thing about being able to use these data from MarketScan was our ability to look at the prevalence of use of anesthesia services from across the country. And so our study showed that the use of anesthesia services was much higher in the Northeast and the Southeast region of the United States compared to the West. It's very, very common in the Northeast and the Southeast, and actually less than 10% of colonoscopies in the West are done with anesthesia services.